Can pictures of babies cause controversy? They can if they're unborn babies and show them to be living, fully formed, and active. This is what Sherry Richard, an ultrasonographer, discovered when she attempted to show ultrasound images of developing and very active unborn babies during House and Senate subcommittee hearings. These hearings were from the Freedom of Choice bill. This proposed bill, if enacted into law, would legalize abortion on demand through all 9 months of pregnancy and end all state restrictions on abortion. The following excerpts are from these hearings.
Pro-abortion testimony dealt almost exclusively with the hard cases of rape, incest, or the life of the mother. But former abortion doctor Anthony Levatino told the committee those cases are in the minority.
Patients have many reasons for seeking an abortion, but my experience shows that only a small minority are performed for maternal health reasons or for rape or incest. The vast majority are simply a means of birth control.
Pro-life witnesses like former abortion clinic operator Carol Everett had their own horror stories, but the committee was reluctant to hear them.
I went in the hospital with her, and a general surgeon was supposed to meet me, and he met me. And he said, "Carol, I am not covering up another botched abortion for this man."
If I may interrupt 1 moment, Mr. Chairman, I was just talking to counsel.
Everett's testimony was interrupted by Congresswoman Patricia Schroeder, who suggested it wasn't relevant, and she'd already heard it.
I was told that I was going to be allowed, that this was anecdotal testimony, and that I was going to be allowed to testify about this particular case.
The subcommittee majority did block sonograph expert Sherry Richard from showing the formation and activity of the unborn child in the womb as part of her testimony.
And I am here today to let you view for yourself without me trying to explain. Let you see the babies for themselves.
I'm afraid that the subcommittee is not going to permit VCRs. We just have a general rule on that. We have lots of requests for them from both sides of the aisle.
First of all, I don't recall that there ever was a vote in the subcommittee to censor witnesses' testimony. And in the 10.5 years that I have served on this subcommittee, there has never been an attempt on the part of any member of the subcommittee to restrict how the witnesses present their presentation. Was there ever a rule of the subcommittee that was adopted when the Republican members weren't here that prohibits witnesses from presenting VCRs or other type of video presentations?
No, but the rule is very clear that the majority of a subcommittee makes a decision as to how testimony shall be presented. And we like to hear oral testimony, written testimony, and we like to be able to ask questions.
Further parliamentary inquiry, when did this vote take place, Mr. Chairman? You said that the subcommittee decided, and I don't recall the subcommittee has ever decided that.
The gentleman can have a vote anytime he wants.
In other words, further parliamentary inquiry, the gentleman from California says that there never has been a vote of the subcommittee. And is it true that the gentleman from California is applying a new rule to this particular witness at this particular time?
No, yes, gentlewoman from Colorado.
I have the time of the parliamentary inquiry. I would prefer that the chairman answer that question.
The rule is that the subcommittee, through the chair, can decide how the testimony shall be presented.
There were video presentations and photographic presentations that took place in another judiciary subcommittee. I also serve as a member of the Science, Space, and Technology Committee. And every time the astronauts come back from outer space, they come before our committee with videotapes about what they did in outer space and what they saw in outer space. So this is an attempt at censorship of a pro-life witness's testimony that is not in the keeping of a subcommittee that is supposed to be concerned about civil rights, and the right to petition Congress for redress of grievances and the right of free speech are among the most precious civil rights that are protected by the United States Constitution. Now, the First Amendment to the U.S. Constitution doesn't just protect the right to free speech and the petition of Congress when we agree with the Speaker. It protects the right when we disagree with the Speaker. Now, I know that the Democratic majority of this subcommittee has got the votes to gag Ms. Richard. And I would hope, Ms. Richard, after you're gagged by the majority in this subcommittee, and complete your testimony, you move that videotape machine out into the hallway, and you can present out in that hallway what you are not allowed to present in here by the fiat of the chairman of this subcommittee who happens to disagree with your particular viewpoint and mine.
Sensenbrenner walked out of the hearings in protest of that ruling. Richard made her presentation without the tape, but said that the committee's position was similar to that of abortion professionals.
Well, you know, I think it's really ironic that you are keeping me from playing this, because I get the same story from people that come in to have abortions. The medical profession tells us that we are to turn the monitor, because that just might influence her choice. And maybe these babies might just influence a few people here and out there when they see that. But I will go ahead with my testimony as you suggested, Mr. Chairman. Personally experienced many women change their minds about abortion, and many people change their minds about being pro-choice when they view that little baby within the womb. We've ignored what's going on in that womb for too long, and it's about time the world sees it. And many of my patients state that, why aren't we telling them? Why aren't they telling them about the physiological development of the baby and still referring it to a glob of tissue when technology has proven that it's not a glob of tissue? That's ignorant, calling it a glob of tissue when you're seeing an 8, 9 week, 10 week baby jumping around. And if a 3-year-old can recognize a baby, then these medical professionals should be able to figure out a glob of tissue from a totally formed baby. Many women are finding out these facts after they've had the abortion and are suffering from the severe guilt and anger of not being told. I was a victim of abortion. I was told it was a glob of tissue. When I went into ultrasound and found that little baby moving around, I was angry because I was not told. And my whole point is, if women have the right to choose, then they have the right to be informed in order to make that choice. Thank you.
Congressman William Dannemeyer had Richard show the tape after the hearing. Congress has held initial hearings on the so-called Freedom of Choice Act, which would prevent states from restricting abortion in any way. Congressman Henry Hyde, author of the Hyde Amendment, which bans the use of federal funds for abortion, says the bill is extremely broad.
By its terms and by the statements of its chief sponsors, it admits of no exceptions. It's abortion on demand throughout the term of pregnancy, so it is far broader than even the language of Roe v. Wade.
Hyde also says hearings on the bill have, so far, not been fair.
The pro-life side, at least the 2 hearings I attended, one in the House and one in the Senate, did not get a fair shot.
7 witnesses were called before the Senate Labor Committee to testify on this bill. Only one of them, Sherry Richard, was pro-life. She was allowed to show the first 5 minutes of her tape at the Senate hearings, but only after protesting and originally being denied.
Neither committee wanted to see that. They admit video cassettes in other testimony, in other subjects, but they didn't want to be bothered by the facts in this one, and so that's sad.
Richard calls her ultrasound video, which makes use of recent technology, window to the womb.
And many women have changed their minds about terminating their pregnancies when they view that little baby on the screen. They are told it's a glob of tissue, a product of conception. In fact, I have been personally told to turn the monitor when women are considering to abort their pregnancy because it might just influence her choice.
Richard's video shows fetal heartbeat at just 4 weeks and a highly active unborn baby at just 10 weeks.
I'm going to name this baby George. He's only 10 weeks old.
10 to 12 weeks is when most abortions are performed.
I have saved over 100 babies by not opening my mouth, by just showing that baby, that ultrasound to the mother.
Dr. Louis Gressley, a former chief of obstetrics at a Philadelphia hospital, was at the witness table with Richard, but appeared to sleep through much of the videotape. He belittled the tape evidence.
You're wishfully thinking. You're reading into it your feelings, not scientific fact. An amoeba moves. Does an amoeba have a brain?
Gressley cited his contention that a human fetus could not live on its own cocoon until about 24 weeks.
You may not like the thought, but at that point, it represents an obligate parasite. And no woman is required, no person is required to help anybody or any other person that in any way puts their life in jeopardy. And it is an obligate parasite. It cannot live on its own.
Gersley and Dr. Herbert Jones, an obstetrician from Virginia, argued for abortion on demand, citing cases of rape and incest and the danger of back alley abortions. Statistics indicate that only about 3% of abortions fall in that category. Richard said she was concerned about these women, but her testimony was an effort to tell about the babies.
I want to hear more about what about that little parasite, so-called, which is, I can't believe that word was even used, and to have him say that George that was jumping around like that was reflex? Now he's wounding up for another jump. If a woman has a right to choose an abortion, then why don't you start telling her on all the facts so she
What you seem to be saying is that a number of these women have not really had a full right to choose because they really haven't been informed concerning both sides of this issue. That's what you seem to be saying to me.
You've heard the pro-life and the pro-choice debates, and now you're going to hear from the babies themselves. You're going to view into the window to the womb and watch the baby in their natural prenatal environment. And then I ask each one of you to decide, are these babies alive? Are they human?
Oh, celebrate life and live it with zeal. Give unto others the love that you feel. The greatest gift I give to another is the gift of myself. There is no other. Celebrate life through the heart of the child. Embrace every moment, begin with a smile. Give unto others by daring to care. See the new day dawning through the love that you share. Oh, celebrate life. Oh, celebrate life. Oh, celebrate life.
For as long as there have been babies born into this world, mankind has wondered about how life begins and develops in the womb. Now, with the advent of new technologies like real-time ultrasound imaging, we can see in exquisite detail how an unborn child is formed. Ultrasound utilizes high-frequency sound waves and is a safe procedure for both the mother and the unborn child. The sound waves are transmitted into the mother and are reflected back through a transducer. A computer will then tape these electrical pulses and convert them into an image, which we can recognize as the unborn child. Sherry Richard is a registered ultrasound technologist who has the opportunity of watching the unborn in the privacy of the womb and has experienced firsthand the many wonders and benefits of this exciting technology.
It's a rewarding experience for me as a sonographer to introduce these babies to their parents for the first time. Each of them seem to have a unique personality of their own, and usually they'll give quite a performance to their parents.
Will ultrasound have any effect on the baby at all?
No, not at all. In fact, we've been doing tests for 20 years, and they haven't been able to find any biological effects at the diagnostic exposures we use, so you don't have to worry. Anyways, I'm going to get started now. I'm going to put some cold gel on you. There you go. That's going to help transmit the sound. Does that tickle?
It's cold.
Okay. This is your bladder, and this is your baby right here. He's jumping for you. Look at him.
Wow, I can't believe how developed he is. Look at him move.
Yeah, he's been well developed since 8 weeks. He's had all his parts. Look at him. Oh, look at you.
How come I can't feel that?
You won't until the 4th month, but he's been moving in there since 8 weeks. He's got a whole lot of room in the womb to move, and with all that fluid, they're able to move around, do somersaults. You know, look at him. Do you believe it? You're going to have your hands full, girl. Look at that.
Is he healthy?
He looks healthy, but the doctor's going to have to take a look at the films. But He looks real healthy to me. Look at that.
Wow, I can't believe that ultrasound will show so much.
Isn't it amazing? Look at him. Look at his head. Look at
That's
his
great.
hand.
That's
so
wonderful.
Cute. You got a cutie.
Besides giving us the ability to observe the baby's actions in the womb, ultrasound provides extensive clinical information about the baby's well-being.
During a general survey, we can determine the gestational age of the baby and offer information about the baby's well-being. Great progress has been made in treating the baby in the womb. With the invention of biopsy transducer, surgery can be performed while observing with ultrasound. Procedures such as blood transfusions, biopsies, fluid aspirations, and amniocentesis can be performed within the womb, and the baby can now be treated as a separate patient.
Ultrasound has also been a superb tool for teaching us about our prenatal development stages. The images you're about to see will reveal in all its wonder and mystery the beautiful continuity of the unborn, the growth and development of a human embryo and fetus from 3 to 4 weeks after conception to just before birth. The birth of a human life occurs at the moment of conception, when the mother's egg or ovum is fertilized by one of the father's sperm. During this act of conception, the two cells become a single living cell, a unique individual who never existed before in history and will never be duplicated again. You are so small that the naked eye could not see you. During ovulation, when the mother's egg is mature, it is released from the ovary to await fertilization. As over 200 million sperm enter the cervix, they begin their search for the egg. If an egg is present, they will stream purposely toward it at a rate of 3 inches per hour, through the cervix, the uterus, and up the fallopian tube to meet the egg. Only one of the 200 million sperm engaged in this race will unite with the egg, and you won the race. The chance of you being born is 1 in 200 million. See what a miracle you are? You are a unique and very special person. In the next few days, the fertilized egg divides into many cells and begins to travel down the fallopian tube and enters into the well-prepared endometrial lining of the uterus. This ball of life will grow at a rapid rate to become an embryo, the next stage of development. At 4 to 5 weeks from conception, the embryo measures only 1/4 of an inch, about the size of an apple seed. Its heart begins to beat on about day 18.
This is an image of just 4 weeks. Can you see the heart beating? Listen to the Doppler of that heart. This embryo is 5 weeks. You can clearly see the formation of the head and body.
As the embryo reaches the 2nd month, it will measure approximately 1/3 of an inch. The dark circles of the eyes are the retina and can be clearly seen. The beginning stumps of the arms and legs are beginning to grow. The embryo floats freely in the amniotic fluid, which will cushion and protect the baby for the 9 months he will spend in his mother's womb.
Now this is a 7-week baby. I'm going to magnify this image, and now you can clearly identify the arms and the legs and the head. Watch him as he moves. This is another 7-week baby. Here's the uterus, gestational sac, and the baby. Again, watch as he moves within the sac. 7 weeks is the time that we first visualize movement. Here's the yolk sac, which will supply the nutrition for the baby until the placenta can take over.
At 8 weeks and measuring 1 inch, the developing baby is no longer an embryo, but a fetus, meaning young one. All the organs are now present but need to develop and grow. The head is about half of the total size, and the brain tissue is growing rapidly. Brain waves are recorded by this time. Individual toes and fingers are formed and can be seen by ultrasound.
Now this is a 9-week baby. It's difficult to delineate the organs, but a new technique called transvaginal sonography has recently been adopted, allowing a superb resolution. Now you can clearly view the head, the arms and the legs, and the heart, just by focusing within a few centimeters of that baby. By introducing a Doppler signal through this heart, we can measure the heart rate.
At 9 to 10 weeks, the fetus is 2.5 inches long and floats in the amniotic sac, which by now has filled the whole uterus. Vigorous activity can be seen as the baby kicks, jumps, turns somersaults, grasps with fingers, opens his mouth and sucks his thumb. Bones, muscle, and the nervous system continue to develop. The baby has begun to breathe the amniotic fluid, but does not drown because it gets oxygen from the umbilical cord.
This is a 10-week baby, and he's now able to move vigorously within the womb. There he jumps, just waved at you. Now he's going to do a jump for you. There he goes. He's able to utilize the whole uterine cavity now because he's got all this space to move. Here he's going to get ready for another jump. There he goes. Now he's turning and looking at us. You can see his eyes. Here he does a few more jumps. The mother, he would not hold still for 30 minutes, and his mother was really impressed to see what he could do. Now he's going to do a few more jumps, turn on the stomach there, I think. Let's see, yeah, there he goes. They're real active at this time. This is my favorite time to do an ultrasound. Waves his arms. Can you see his hand? His 5 fingers. Now this is another baby that's 10 weeks old. And this baby's laying on its stomach, and this is the head and the body in the back. Now he's going to turn and look at us. Turn over on his side. There he goes. And now he's laying on his back.
By the end of the first trimester, the baby measures only 2.5 inches and weighs about 1 ounce. There is still a lot of room in the womb, and the baby is busy utilizing his private playground. He resembles an astronaut as he floats and jumps around.
This baby's only 11 weeks old, and he's going to suck his thumb for you. He's going to take his hand and put it in his mouth. There he goes. They develop their habits in utero. This is another baby that's 12 weeks old. By the end of the first trimester, all the organs are functioning, and the calcium has begun to replace the cartilage. He's on his stomach there. There he goes. This is the bladder, the cervix, and the uterus, the home that the baby will live in for the full 9 months. I'm going to magnify the sac, and now you can clearly see the baby. See the detail of the spine? And this is the brain. All the brain tissue is now present. See the detail of the face? You can see the eyes and the mouth. This baby's going to open his mouth for you. Watch him. Now watch, he's going to scratch his chin for you. Watch him. Now, to determine the gestational age in the first trimester, we measure the baby from the top of the head down to the bottom of the rump, and we can get within 2 to 3 days of accuracy in the first trimester. Now, this is another 10-week baby. He's laying on his back with his head over here, and his feet over to the left. Watch as he moves within the womb. You see those little feet kick? They're busy in there. Now you look real carefully at the feet, and you're going to be able to identify the 5 toes. He's got his foot and his leg developed there, and he's just shaking it to show you.
In the 4th month, the baby will grow to be half as tall as its birth height, about 12 inches. The baby has begun to crowd its living quarters. The skin is so transparent that the branching blood vessels can be clearly seen. Because of the increase in size and strength in the baby's movement, the mother will begin to show and feel the first stirrings of life within her. Fine hair has begun to grow, and sex organs are now apparent. The body is equipped with a complete set of vocal cords, but of course without air he can't make a sound. Sometimes on ultrasound, you can see the baby making crying gestures.
Now this baby's 14 weeks old, and he's going to try to stand on his head in a minute. This is his head and his back. Now watch him as he climbs that uterine wall. Can you see? Look at that back arch. See how limber they are? They can do more in utero than a newborn baby can do outside of the womb because of the amniotic fluid present. Look at he struggles to stand on his head there. Now this is another 14-week baby. He's laying on his back with the head over there. And this is his back. In the 2nd trimester, all the organs can be easily identified. Here's the heart beating, and here's the stomach. The baby swallows the amniotic fluid. Over here is the kidney that can be clearly seen, and the baby urinates in utero now. Over here is the diaphragm. As the diaphragm moves up and down, the baby is breathing. And again, look at the heart. You can see the separate chambers of the heart and identifying the different valves. Listen to the Doppler of that heart. Here's a color image of the blood flow through the heart. This is the detail of the spine. Look at the fine detail of the vertebrae through the cervical and the thoracic area, down through the lumbar and to the sacrum. This is an image of the face. You can see the orbits and the fine detail of the eyes and the mouth. This is an image of the baby's face. In a minute, you're going to see the clear detail of the nose and the lips. Look, you can even see the nostrils. This is a hand. He's making a little fist at you right now. You see the 5 fingers? And this is another hand, and he's pointing his index finger up. You see that? This is a picture of a leg and a foot. And this is a boy. We call that the turtle sign. And this is a girl. This is an image of the placenta. It will supply the nutrition for the baby for the full 9 months. It is attached to the umbilical cord, which attaches right here, right there. You can see the umbilical cord, which attaches to the baby. This is a picture of a head. We measure the baby's head and the abdominal circumference to determine the gestational age in the 2nd trimester. And you can see us measuring there. And then we also measure the baby's femur bone to determine the age.
just 3 months, the baby's weight will triple to more than 7 pounds and grow to 20 inches. The living quarters become very cramped. Approximately 1 week before the 40th week, the infant stops growing and drops his head down into the mother's pelvis. And now the mother and child just wait for the big day.
This is a picture of the baby's face. You can see the eyes, the nose right there. Watch him as he yawns for you. There he goes. You can see his eyes. Now this baby, you can see his hand rubbing his face. See the eyes and the nose. Now watch his hand. He's going to do a reflex action for you in a second here. There he goes. Now watch his face. His face is going to come in a minute. You can see the eyes. And watch real carefully. You can actually watch him open and close his eyes. See that? You see his nose?
Amazing.
See his eyes open?
Yeah.
Okay, now this baby is going to open his jaw for you.
Oh.
Watch him. You see his chin? Now this baby's going to yawn for you in a minute. He's getting ready to take a nap. Isn't that cute? Okay, now this baby's going to stick out his tongue. There he goes. He's going to do it again. He's just licking his chops. Watch him. There. Well, what do you think of those babies? What do you say to that, baby? Thumbs up. Okay.
Ultrasound truly is a window on the womb, through which we can view a human being in its earliest stages of development and immeasurably deepen our understanding of the miracle we call life.
You know, I have a special attachment for these babies as I watch them in the womb develop and grow. And you know, it seems our society has a way of denying the existence of anything we can't see, feel, and hear. And I believe if a window was placed upon the abdomen of every pregnant woman and the world could see what I view every day, that there really would not be an abortion issue and the unborn would be recognized for its constitutional rights. You know, our society has adopted a free choice mentality based on the quality of life ethic. Doctors who were trained to provide health and healing for their patients are now put into a position of moral compromise and are now asked to destroy human life. They say that women have the right to choose what they do with their own body. Well, you know what I say to you pro-choicers? Then don't they also have the right to be informed in order to make that choice? Do you know that abortion is the #1 surgical procedure performed in our country and is the only surgical procedure where the physician doesn't have to divulge any of the information necessary for that woman to make her decision? Information of the physiological development of her baby. They refer to the baby as the unborn as a product of conception, a glob of tissue, anything to dehumanize that baby. 10 years ago, before ultrasound's resolution became so superb, it resembled a glob of tissue. But now ultrasound has literally disproven that theory, and that little 8-week baby has little arms and legs that we can see move. And that little heart is beating at just 4 weeks conception that we can now see. And I have had many women come to me considering abortion. And I have been personally told to turn the monitor away from women considering abortion, so that seeing her unborn baby moving and jumping around does not influence her choice. And I didn't comply with that, feeling that a woman has to see that in order to help her make her choice. And many women have decided to keep their babies after viewing the ultrasound. In fact, they've been using ultrasound to make induced abortion safer. in the abortion, while doing an abortion, they can literally use ultrasound to assist in the abortion procedure. In fact, it says here in an OBGYN News, February 15th, 1986, written by an abortionist, sonography can make induced abortion safer, but care must be taken so that its psychological impact is not negative. Seeing a blown-up moving image of the embryo she is carrying can be very distressing to a woman who is about to undergo an abortion. She stressed that the screen should be turned away from the patient. Staff members may also be affected by the sonographic images and may need opportunities for venting their feelings and reconfirming their priorities. And I bet it's very hard for those staff members to literally watch a baby be dismembered. And she does have to vent her feelings to be able to do anything like that. In fact, I had a patient that came to me that was pregnant, and I had to determine gestational age. She had a 3-year-old little boy with her. When I started doing her ultrasound and the baby started jumping around on the screen, her little 3-year-old said, "Mom, look, there's his hands, there's his head, there's my baby brother." And the mother was really surprised to see this little baby moving around so much. And later on, she told me that the next day, she was scheduled for an abortion, and she thanked me for showing her her baby. And she says, "Why wouldn't anybody tell me my baby was so well formed and moving around?" And I say to the abortionists, I say to them, if a 3-year-old can recognize hands and arms and legs in a fully formed baby, then these abortionists, medical doctors, should be able to tell a difference between a glob of tissue, a product of conception, and a formed baby. They don't tell you of the complications of that abortion procedure. There's a possibility of infection due to retained products of conception, or other name is fetal parts, baby parts left behind. Uterine perforations is when they actually go in and they puncture the uterus. Hemorrhage and possible maternal death. In fact, I work in the emergency room, and it is not uncommon for me to get these cases brought to me. And one such case was a severed head left behind from a suction abortion. And it's not uncommon for me to see placenta, retained products of placenta, infection, bleeding. There's an increased rate of sterility in women that have had abortions. Ectopic pregnancies, those are pregnancies that are implanted in the tube. Premature births due to cervical lacerations when the cervix has been literally stretched and doesn't go back to normal position. So when the mother carries her baby in the second trimester, the cervix is unable to hold her baby, and she literally delivers the baby early. And they don't tell you about the alternatives for abortion. There's 1.5 million babies being aborted per year. And there's women out there that are trying to adopt that cannot find a baby. I have a girlfriend that has been trying to adopt a baby for 5 years. She couldn't find one. She went to have an ultrasound done for her ovaries for fertility. Right across the curtain, there was another girl having an ultrasound for gestational age. She was pregnant. And the ultrasound technician was describing the baby parts, the arms and the legs, and she said, "Shut up and turn that monitor, because I don't want this baby. I want an abortion." And Rose would have given anything to have had her baby. And she walked out crying. And it's just not fair when we're destroying 1.5 million babies in the womb per year, and women that want babies cannot find one to adopt. Then they don't tell you about the gruesome torture that that unborn baby will have to go through. First trimester, they do a suction abortion, where they insert a tubing through your vaginal canal hooked to a high-speed vacuum that literally dismembers your babies inside the womb. Second trimester, because your baby's too large and developed to fit through the tubing, they do a saline abortion, where they take a high concentrated salt solution, inject it into the womb through the amniotic fluid. The baby breathes and swallows it, and it literally takes 3 to 4 hours to slowly burn that baby. And these babies come out fried and black. There's some incidents of live births with this kind of procedure. So to eliminate that problem, they do a dilatation evacuation method now, where they actually take forceps, go in, and dismember your baby inside the womb, so there's no possible chance of delivering a live baby. Many people are unaware that abortion is legal up till term. What the Supreme Court stated was first trimester, there would be no legal restrictions. Second trimester, it would have to be done in a safe clinical environment. Third trimester, if the mother's life was in danger, that was reason to have an abortion. And health was described as emotional, physical, and age. So if this pregnancy is causing you emotional distress, that is reason enough to have an abortion. And there's doctors out there that will do it if you have the money. And for that procedure, they do a normal cesarean section. They do an incision down your abdomen wall, open up your uterus, take your baby out, cut the cord. Instead of handing the baby to the mother, they place the baby in the garbage to die. These are the facts that the women are not being told. And I believe if women knew these facts, there would not be an abortion decision. What about the women that are finding these facts after they've had the abortion? Many are finding out and are suffering from severe depression, guilt, and nightmares of the decision they made without being informed. Who's taking care of that emotional distress that she's having? I know that feeling because I've had 2 abortions. And I was told it was a glob of tissue, there would be no complications in future pregnancies, and no complications in the abortion procedure itself. I suffered from severe infection and bleeding and fever from retained products of conception, baby parts left behind. And there was later on, I was told after my second abortion, there was a high chance that I could not conceive again. I tried for 5 years to conceive after I met my husband, and I always wondered if possibly I had aborted the only 2 babies that I'd ever give birth to. And it wasn't until I went into ultrasound school, and I literally saw an 8-week baby jump on the screen, and I knew that I had destroyed 2 human lives. And that's when the guilt set in for me. That is when the truth literally hit me between the eyes. And I suffered from that guilt, depression for many years. And it wasn't until I forgave myself and I literally asked my babies to forgive me, and I asked my God to forgive me, that that guilt was removed. And I conceived the first of my 3 children that month. And I cannot bring back my babies, but maybe I can help other women so that when they make their decision, they're prepared and they won't have to go through what I went through. And it's the only surgical procedure where a minor can have an abortion. And the doctor doesn't have to inform, or the mother doesn't have to get this consent from her mother or from the father. Something's wrong. Pro-choice, let's give them the facts. Let's lay your cards out on the table so women are informed so that they can make a choice. I have 2 women, Carla and Cheryl, that saw their ultrasound and was considering abortion but changed their minds. And I'm going to let them tell their story.
When I first met Sherry, I was 9 weeks pregnant. And as you can see now, I'm ready any day now. When I went to Sherry, I was seriously contemplating having an abortion. I was in what you would call a crisis pregnancy because my boyfriend had abandoned me, and I was left to face this alone. I felt like a failure to my parents because, how could I get pregnant? I was in college and everything, how could this happen to me? Well, when I seen Sherry, she scanned me, and at that time I was 9 weeks pregnant. What I seen on the screen was amazing. I seen that the baby was fully developed. It had all of his fingers and toes and arms and legs. It was just a matter of growing. And after I seen it, I was wondering how on earth could I have ever thought about killing my baby? This amazing little life that was inside of me. Through Sherry, I have met a lot of people that were able to help me. I was faced with not knowing how I was going to be able to provide for my baby, being a burden on my family because I had to go back home. through the Crisis Pregnancy Center, they have helped me financially, mentally, and spiritually. They have helped me with clothes for myself as well as for the baby. They have helped me be able to maintain my home and not be evicted, and just there to talk anytime I need it. I just really thank God for Sherry and ultrasounds, and that there are alternatives for not to have an abortion if you become pregnant, and you do not have to be alone. There is help.
So how has your life changed now since you have your baby?
It's wonderful now. He's a joy. He gives my life a new meaning and purpose, because not only is it myself now, it's him. And he's my life.
So now that you've had your baby, you don't regret not having the abortion?
No, no way. I wouldn't have this. Oh my God, Ryan.
Cheryl, let's go back to when you were 17 and it was the first time you found out you were pregnant. What was the first thing that came into your mind when you found out it was a positive?
I was afraid, scared, and being so young, I didn't know what I was going to do. Still in high school. At first I was going to keep it, I remember. But I think just by saying that made me believe it. But everybody around me kept telling me, you know, you're not ever going to be able to take care of this baby. You're too young. You're going to have to go on welfare. You're going to be living in the streets. So it scared me away from having the baby. So I had an abortion.
So you went to a clinic?
Yes.
And what kind of information did they give you there?
Nothing.
They didn't offer you information on adoption?
No.
Did they at all question your desire to have an abortion?
No.
Did they explain fetal development or anything to
Nothing.
you?
Because if I would have known that, you know, I probably wouldn't have done it. No, I didn't know anything. And being so young makes it worse. You know?
Are you experiencing post-abortion syndrome at all?
I was depressed most of the time. I didn't really care about nobody. I was drinking a lot, staying out late, trying to forget it. But I'd come home and wake up and feel the same way, or I'd wake up in the middle of the night with nightmares. I could see it.
What kind of nightmares did you have?
Just having nightmares of blood, tissue, pieces.
Pieces of babies, or?
Pieces of babies.
So it was the video, Window to the Womb, that really made you change your mind about abortion?
Yes.
Instantly, or did you have to think about it?
I didn't have to think about it.
So you
said, nobody's going to do that to me.
You pushed the stop button on the VCR and said, I'm not having an abortion this time.
That's right. I said, I'm not doing it. There's no way.
Well, I'm really glad that you saw that video.
Me too.
Yeah, that's why we're making this tape. We're hoping that this in turn will save some more lives. Your story can save lives.
I hope so.
It will.
Wish I would have seen me a long time ago, before this happened.
What would you say to a woman if you knew she was watching us, who maybe is pregnant and considering abortion, having gone through it several times? What advice would you give her?
Tell her to look at the ultrasound, see what she's really got inside. There's something in there. It's not a nothing. It's got fingers and feet. It's a baby.
That's what I'm talking about. That guilt is so bad. I went through that. And that's what really makes me angry, is the women, even the fathers that are finding out afterwards. What are we going to do with all these people that are finding out the truth now? They're literally in depression. It's not uncommon for me to do ultrasound on women, and after their second pregnancy, after they've aborted 2 or 3, and see the ultrasound like I did, and literally go into shock. I think our world is going to go in shock when they literally find out what's been going on in our nation legally. Whether or not you ever have to make an abortion decision, you're going to have to decide where you stand on this issue. Are you for life or are you for death?
At that very instant, I was given life. I was formed in my mother's body. My bones grew as I took form in my mother's body. When I was put together there, it wasn't too long until my heart started to beat. I was made in an amazing and wonderful way. Before you had a name.